Well, thanks for being with us today. I promise this is the last time we'll do this to you. We're going to start by looking at your skin. So at first we're just kind of looking at the color. It's nice and pink. It's appropriate for race. I'm also going to look at the temperature of your skin. So you're good and warm, but not too warm. Looking at the texture, which is nice and soft and hydrated. And I'm not seeing any presence of lesions or protrusions or anything I wouldn't expect. So I'm going to go ahead and move on down to your lower legs. Again, looking at the same things. We're looking at the color and the temperature and the texture and hydration. Again, looking for any lesions and whatnot. Hair distribution seems appropriate. You shaved it off, but I can kind of see the follicles. I'm not seeing any varicosities or signs of edema, so that's great. Alright, we're going to go ahead and look at your nails. Looking at not only the color and the cap refill, which is good and prompt, also looking at the condition of the nail itself. It's not overly thick or thin, has the right texture. I'm not seeing any signs of clubbing, so we're off to a really good start. I'm going to go ahead and move on to your head. We're going to go head to toe a little bit for a little bit. So just starting with looking at the inspection of the size and the shape and the symmetry of your head. Going to go ahead and check the condition of your scalp and just kind of palpate around your scalp for just a minute.
Okay.
And while we're doing this, we're looking at the hair distribution and the quality and texture of the hair. And everything here seems to be appropriate. So we're going to go ahead and move on down to the face. Going to start here and just kind of palpate around your face. Just making sure I get your paranasal sinuses. And we're going to come right on down here to your TMJ. So open your mouth real big for me. And close. Open again. And close. Alright, not noticing any crepitus or clicking there. So, again, off to a good start. Throughout this exam, we're going to go through all of your cranial nerves. And I'll list them for you. As we're going, we're going to hit all 12, but not necessarily in numerical order.
Okay.
I'm going to start with cranial nerve 5, which is your trigeminal nerve. So what I need you to do, open your mouth really wide against my hand. Good. And close. Open. And close. Clench your jaw really tight and don't let me open it. Good. Alright, go side to side. Perfect. Alright, do you feel me touch you here on your face?
Mm-hmm.
Do you feel me here? Right side?
Mm-hmm.
Alright, and it feels the same on both sides? Perfect. Alright. We're going to move on to cranial nerve number 7, which is your facial nerve. So go ahead and smile real big for me. And frown very sad. Raise your eyebrows really high. Then close your eyes really tight. Don't let me open them. Good job. You can open your eyes. Excuse me. You can puff your cheeks out real big like a monkey. And push your lips. Very good. Okay. You can relax your face however you're comfortable now.
Okay.
Alright. We're going to move on to cranial nerve 2, which is your optic nerve. Normally if you were at the doctor's, this is when we would do a Snellen test to assess your distance vision, or a Rosenbaum to assess your near vision, which are just those charts with all the letters on them, and we say, read the smallest line that you can read, and we'll tell you you have 20/20 vision. But we're not going to make you do all that for today. Right now we're just going to check your confrontation or your peripheral vision, so all I need you to do is tell me when you can see my fingers.
No.
Okay, and again?
No.
Alright. Alright, so let's move on. We'll come back a little bit later to some more tests of your optic nerve, but for right now, we're going to test a couple of your cranial nerves at the same time. So we're going to test 3, which is your ocular motor, 4, which is your trochlear, and 6, which is your abducens. Excuse me. So what I need you to do is just follow my finger without moving your head, just with your eyes. Good, and over here. Great. Okay, so we're going to go ahead and take a look at your eyes. Basically, I'm just going to take a look at the twinkle. I'm just going to turn your light off here. Get my light going. Alright. Good, you got that good twinkle in them. Alright, so as we've been doing all this, I'm kind of looking at your face and looking at the shape of your eyes and your eyelashes and distribution. I'm not seeing any abnormalities other than a little bit of scarring up here. Looking at the external structures of your eyes, the lids, kind of going into the internal lacrimal apparatus and your iris and your conjunctiva and your pupils and all that jazz. And again, not seeing any gross abnormalities, so that's a good sign. I'm going to look at your pupils and kind of see how they respond to light. So I'm going to shine a bright light in your eye for just a second.
Okay.
Alright, one more time. Good. Alright, I'm going to go ahead and kind of palpate your lacrimal sac here. No pain when I do that?
Nope.
Good. Alright, a couple more tests with your optic nerve and then we'll leave your eyes alone for a little while.
Okay.
Just kind of looking at your eyes. I'm going to look at your lens clarity here. Alright. And good, you got that good red reflex. The size and shape is appropriate. Lens appears clear. Looking at kind of the background, not seeing any hemorrhages or exudates or anything like that. Got that good, nice pinkish red color to the vessels. And I'm checking out your macula and your fovea, excuse me. Good. Alright. We're going to move on to cranial nerve 8, which is your acoustic nerve.
Mm-hmm.
So I'm going to be playing with your ears here a little bit. So we're going to start by just looking at the outer part of your ear. So you got your auricle and your mastoid. And then got my otoscope out here. We're going to look at the external meatus and the canal itself on down into the tympanic membrane and to the umbo and malleus and all that fun jazz. And everything looks really good. Alright, I'm going to perform a whisper test now, which is exactly what it sounds like. So
Yes, I can hear you.
yay, how good. Alright, we're going to do something now called a Weber test.
Okay.
Basically, all I need you to tell me, do you feel this vibrating?
Yes.
Alright, tell me when it stops.
Stop.
Good. Alright, we're going to move back on up to cranial nerve number 1, which is your olfactory. So I'm looking at the size and the shape and the symmetry of your nose. And everything, again, looks appropriate there. So I'm looking at the septum and the mucosa, and everything looks good and healthy. I'm going to check the patency of each nostril. So take a big deep breath and another big deep breath. Perfect. Okay. So just looking at your lips, and they look good. And as you've been talking, we've been looking at your teeth and your gums, and they look really good. So just open up real wide for me and lift your tongue up. Just looking at your frenulum, and I'm going to look at your Wharton's and your Stenson's ducts here. Alright, open real wide, hard and soft palate, look really good. Do me a favor, say ah. Alright, checking out your uvula back there. All of that together is kind of assessing cranial nerves 9 and 10, which are your glossopharyngeal and your vagus, respectively.
Okay.
They're also, what's in control of your ability to speak and swallow and gag. I'm not going to gag you
Good.
during this assessment. I don't think that sounds fun. Everything else
Get
seems to be
milkshake on you.
well. Everything else seems to be working appropriately, so we're not going to worry about all that.
Good.
I am going to assess number 12. So if you will just stick your tongue out at me. All right. And wiggle your tongue around. All right, perfect. All right, just going to feel down your neck here. Again, looking at your neck, noticing back here, no protrusions at the spine. All right, go ahead and touch your right ear to your shoulder, and your left ear to your shoulder, and your chin to your chest, and all the way back. Perfect. We'll do it again a little bit later in the exam for another part, but for right now looks good. Right now, just press against my hand with your head, and again, and then try to lift your shoulders up with me pushing down. Okay, all of that is part of cranial nerve number 11, which is your spinal accessory nerve.
Okay.
So we're going to move on down to your trachea. So everything looks appropriate. Going to go ahead and feel. Again, everything appears symmetrical and correctly placed. Going to palpate some of your nodes here. So we'll start with some of your pre and post occipital On down into your submandibular and your submaxillary. Into your anterior and superficials. And the cervical chains. And on down to your supraclavicular. Say that 5 times fast.
Mm-hmm. Oh, thank you.
Alright. And I'm looking at your carotid arteries. I'm going to go ahead and palpate those, not at the same time so you don't pass out. Oh, I should move my hand so she can actually see it. Alright, I'm going to go ahead and take a listen to those. Alright. I'm going to go ahead and check out your thyroid gland, which I'm sure you remember from the last assessment, so I'm just going to kind of shift your trachea over here. And, okay, we were able to palpate it, and I'm going to go ahead and take a listen here. Sorry, I know it's uncomfortable. Okay. Alright, we are done messing with your poor head, so we're going to move on down to your chest. So basically I'm looking at the shape and the chest wall symmetry and the chest rise and fall, looking at your thoracic expansion as you're breathing. I'm going to go ahead and palpate. Not feeling any bulges or masses or lesions, things we wouldn't expect to be there. If you will just turn your back toward me and the camera, we're going to check that tactile firmitus again, so if you'll just say 99.
99.
Again.
99. 99.
And again.
99.
Okay, gonna go ahead and percuss. And we'll check for that diaphragmatic excursion. Alright. And we'll go ahead and move on to listening to your lungs. Alright, big deep breath. Alright, so we can go ahead and move on to the cardiovascular section. So I'm looking at your chest for any heaves or lifts or thrust. You can go ahead and turn back around toward me.
Okay.
And again, we already palpated. So, excuse me, so we're going to go ahead and go to your auscultation. So we'll start over here. And then we'll move over here to the pulmonic area. And during this section, S2 is louder than S1. It's when we start getting down here to Erb's point that the sounds kind of level out. And then by the time we're down here at tricuspid, S1 has taken over and is louder. And then we're going to go up here and listen to your apical. Perfect. Alright. I'm going to go ahead and palpate some of your pulses here. So we're just going to feel your temporals. And your brachials. And your radials. Alright, we're going to move on down here to your legs and find your popliteals, your posterior tibials, and your dorsalis pedis. Alright, if you'll lay on back on the bed for me, we're going to take a look at your abdomen. So we're just going to start by looking at the skin. Not seeing any abnormalities to your umbilicus or any hernias or bulges or masses. We're going to go ahead and take a listen to your stomach. Just listening for vowel sounds or like pleural rubs over the organs. Alright, gonna go ahead and percuss kind of around these areas. Alright, so we're gonna percuss and measure your liver again, okay? Tape on your hair. Ooh, can't grab the tape. Okay, so we go ahead and measure this. And we expect this to be between 4 and 9 centimeters, and yours is right on. So I'm going to come over here and press your spleen, which normally I'd stand on the other side of you, but okay. I'm going to go ahead and palpate your liver. Any pain here?
Nope.
Any pain here?
Nope.
At the spleen, and then we move on to the kidneys. No pain.
Nope.
Okay. Now seems like a good spot to scan the room and show you I don't have any study aids and whatnot. Doodle doodle doo. Nothing, nothing, nothing. That's just my supplies.
Mom's room.
Mom's room. All right, Mom, we're going to have you go ahead and sit up. Just kind of looking at your joints right now. So we're looking at your elbows, your wrists,
Towards
all
you.
that fun jazz. Yeah, just turn your legs toward me. We're going to kind of start with your neck. So I want you to flex your neck forward for me, chin to your chest, and all the way back, and ear to shoulder, and ear to shoulder again, and then just turn your head all the way around. Very good. All right, now we're going to do the same thing, but with a little bit of resistance. So push against my hand, push against my hand, and push against my hand, and last one, push against my hand. Perfect. Okay. So we are going to do your shoulders now. So push up against my hand, and pick your arms all the way up to the side, bring them all the way back into your body. Good job. You do exactly what I
Took
do.
a second.
Well, you don't even need to do that. That's just me. All right, go ahead and flex your arms up. All right, I'm going to try to pull them down. Don't let me. All right, good. Straighten your arms all the way out and try to bend your arms. Good job. Perfect. All right, I'm going to try to push your arms down. Don't let me. Okay. And then just bend and straighten your elbows for me. Good. Turn your hands up and turn your hands back down. Very good. All right, you can relax your arms. So I want you to bend your elbows and flex your biceps for me. Biceps and triceps. Just move them all around. Very good. You make a very excellent Superman. All right. Bend your wrists with your palms down and turn your hands to the right and to the left. All right, spread your fingers out. Push them back together. All right, again, same things, but I want you to push against my hands. Push against my hand and against my hand with your wrists. All right, now spread your fingers out. Don't let me push them back in. All right, now keep them together and try to spread them out. Very good. All right, you can relax your arms. We're going to move on to your hips. So I'm going to have you lay down flat on the bed. Keep one leg straight and this knee close to me, just bent. Perfect. I'm going to bring this knee up here to your chest, and I just want you to keep this leg straight. That's your job. And I'm just going to move this around, make sure you got good range of motion.
Quite flexible.
Huh?
Quite flexible.
Oh, I am aware. All right. All right. So I want you to try to straighten this leg out. All right. Now actually lower it flat. Try to bend it. Bend it. There you go.
Sorry.
All right. Try to push your knees together and try to move them apart. Good job. Okay. You can sit up again and just have you sit on the edge of the bed again. All right. Straighten your legs all the way out toward me and pull them back in towards you. Straighten them out again. Push against my hands and pull them back in toward you. Good job. All right. I'm going to have you point your foot up to the ceiling, toes toward your nose, and point your toes down toward the floor like you're pressing on the gas. Pick up against my hands. Good. And push against my hands. Very good. All right. Going to have you stand up for just a second. Just going to look at your spine. So if you'll turn your back toward the camera. All right. So if you'll bend to the right. There you go. And to the left. All right. Bend as far backwards as you can. And as far forward as you can. Try to touch your toes. There you go. Stand up nice and slowly. Slowly.
Oh.
Gotta watch. Gotta listen for the instructions. Just looking at the shape of your back, checking for any scoliosis. All right, I'm gonna have you walk. So if you'll turn and face the camera, I'm just gonna have you walk toward the camera. I'm just looking at your gait here, and then just come on back when you're done. Come on back. All right, now we're gonna do it again, but we're gonna do a heel to toe gait. So I want you to put your right heel against your left toe, and then your left heel against your right toe. Perfect, just like that. Lovely. All right, you can come back and stand over here with me again. We're gonna test your, we're gonna test your Romberg sign. So I just need you to keep your eyes closed, feet just a little bit apart, so just like you got them is perfect. And I'm just gonna gently push you. Good job. All right, so, had to think for a second. Alright, what I need you to do is take the heel of your right foot and put it on your left shin and just go up and down. Good. And now we're going to switch and do your left foot on your right shin. Up and down. Good. And take your hands palms up and just flip them over and then try to alternate them. So have one up, one down. There you go. Perfect. Put your finger to your nose and then touch my finger. And back to your nose, touch my finger again. Good job. All right, you can have a seat. I'm going to hand you an object and I want you to tell me with your eyes closed what's in your hand. So close your eyes. What's in your hand?
An earplug
Very
for
good.
sleeping.
All right, with your eyes still closed, I'm going to write a number in your hand. I want you to tell me what it is.
3.
Very good. All right, so you're going to feel me touch your hand. And what do you feel? Is it sharp or dull?
Dull.
Very good. All right. You're going to feel me touch your hand one more time. And I want you to tell me when you start to feel 2 things instead of 1, okay?
I feel 2.
All right, that's just your position sense, and we're just measuring how far apart it takes to get that, and that yours is appropriate. So you can open your eyes. Very last thing we have to do is just check your reflexes.
Okay.
So we're going to check your biflex reflex here. I'm just going to support here. Alright, and we're going to test down here your brachioradialis and your tricep.
Socket.
Alright, I'm going to jump down here to your patellar. Good job. And your ankle reflex. Alright. Well, I think I'm done poking and prodding on you. Thanks for being a part of our assessments.
Thank you,
Oh.
nurse.
4 times that we've done this.
You're a good nurse.
Thanks. You're a little biased.